It was a gun.
I'm not voting.
If we want to build our nation.
The problem with the Somalians.
Just want to experience something else than a black man.
Move on, move
Can't be
forward.
like a horse with blinkers on.
Honestly say, I was about to have
Corrupt
sex and then I pulled
crap,
up.
but it's nice.
Nasima Khan, I'm a pediatrician at Albert Lutuli Hospital.
I'm Loazi Manzi, I'm an intern in the Pietermaritzburg complex.
I'm Jitesh Rajpal. I'm a junior doctor serving my internship at Mahatma Gandhi Hospital and Addington Hospital.
I'm Shiksha Bindapasad. I'm an anaesthetist at Mahatma Gandhi Hospital.
My name is Rinesh Chetty. I'm a third-year orthopedic registrar at King Edward Hospital.
And my name is Lungile Sitrava. I'm also a medical intern in Pietermaritzburg Complex Hospitals.
We went on strike to make a statement. Unfortunately, it was the government that stretched it out. And if they allowed us to make our statement and said, listen people, we hear you, let's do something about it, it would have had a different outcome. But they just turned the propaganda machine on. Yeah. They made people angry, the public and the doctors, and that's why we're here where we are today.
Nobody listened, and the thing is that they should have listened. If they just engaged us constructively instead of setting out this whole defensive barrage to just essentially try and blow our circuits, it didn't work. It should have been, okay, we have a problem, let's all sit down together at the same table and sort this mess out. It shouldn't have been, oh well, yes, we have a problem, but we would like to protect our public image and tell the public something else and actually tell you guys a whole different ballgame.
It's come down to a point that you see, and this figure that always gets thrown around, 15% of doctors in this country treat 80% of the population. 80% of the population do not have a voice. They think that they walk into King Edward, they walk into whichever hospital that you go to, and you see cockroaches, you see ants, you wait 6 hours in a line, you collapse in that line because you can't get food. That's actually what they're entitled to. I know that's balls. That is absolute crap. And at the end of the day, if you're standing there and you're willing to see a patient every 5 minutes so that you can push that line through, so that you can stop that patient from waiting 6 hours, you're committing a crime. Because you're allowing the government to get away with this sort of, let's just make do. Let's make do. Come push, go doctor, go do what you need to do, because you're a doctor, you got a Hippocratic oath. Here's a gun to your head. You're not allowed to strike. You're not allowed to open up your mouth. You're not allowed to talk about the hospital that you're sitting in. So push it through. And that's what we said. We said, no, balls, that's it.
In the current healthcare system in this country, I think we're doing our patients more harm than good by still continuing to support a structure that really, if we just let it run on the spare wheels it should be, it would collapse. And the truth of it is, we're doing our patients a huge disservice.
You come out of medical school, with all this knowledge. You've read in the textbooks, this is what's required for you to do for your patient. You come into the actual working environment and you see that you cannot get a CT scan for a patient who has a stroke.
You can't get.
And then you realize that.
Can't get a 1
certain basic things that you as a doctor know is essential, absolutely essential for the management of the patient. You are not allowed, and you are refused, and you are told there are no funds.
We don't even have a temperature probe at Northdale. A temperature probe at casualty.
What your patients trying to do?
That is why
High care at Mahatma Gandhi doesn't even have a SATS probe.
SATS monitor. We don't have a SATS
monitor.
Now,
I keep my patients in the recovery room in the theatre for an extra hour or two if I'm concerned about them, and I'd rather monitor them myself. That's theatre time, but I am the only anaesthetist who's on the floor, so I would rather have the patient under my care and know they are safe than freight them to a ward. I wouldn't even call it a ward. It's a bed with a chair. Big deal.
Well, in fact, you know how government likes to throw babies out there, for public sympathy. Well, speaking of that, you know how we never have ICU beds for babes.
Yes.
At some stage at Northdale, we had 3 babes that needed beds urgently, and we had 2 babes on the anesthetic machines waiting for beds for hours on end. Now,
we turn our theatres into ICUs.
Exactly. That baby is supposed to be warm. Yes. That baby is, theatre is not warm. That baby is supposed to have proper monitoring, blah, 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 proper nursing. In ICU, you're supposed to have 2 nurses per babe, isn't it? No.
Yeah. I'm sitting here. I was on call last night. So basically, I started my call at 8 o'clock in the morning. Oh, actually, no, I started at 6 o'clock. Started at 6 o'clock.
What's up with orthopedics and ward rounds early in the morning? What's wrong with you guys?
We usually go to gym in the evenings, yeah, that's why. So, yeah, so I started, look at my day. I started at 6 in the morning. I started a slate at King Edward Hospital at 8 o'clock, finished off at about 4:30. Finished off at about 2:45. 2:45 we went for our pediatrics academic meeting in the department. 4 to 5, and my prof wasn't there, so this is confirming it, that we had our proper our proper normal orthopedics meeting, right? And then 5:30 I went straight back to King Edward, did 2 cases, finished off at about 8 o'clock, went down to the King Edward casualty, saw 3 polytraumas, admitted 5 patients, and then saw about 20 patients over the night. And I basically, okay, fair enough, I had about 2 hours sleep, forgive me, right, for having 2 hours of sleep, and then presented again at 7:30, all the patients we saw, went back to theatre to finish off another case, and then discharged a whole lot of patients. And then the only reason I'm sitting here now, what's the time? It's 2. I should still be at the hospital. I normally finish off at about 4. And the reason I'm here at 2. This is today. So basically, what's that? What's 8 to 4 the next day is how much?
32 hours.
32
hours.
Straight.
32 hours minimum.
32 hours.
Straight.
No, it's more than that.
And if you look at my wife, when she sleeps next to me in bed, she says, I talk in my sleep. And I wake up at anything. And like, if she stands up to go to the bathroom, I'm up already and I'm looking what the hell's going on. Because that's what you train, that's what your body becomes. This cell phone does not leave my side. If you phone me when I'm called, you've been my intern, how quickly I answer the phone. Purely because you're always sitting there with this thing in the back of your head. You live your life.
When you're cool, you actually dream about casualties.
That you're at home, you're post-call, and
Post-call, you dream about your
and
patient.
relive your entire call. Exactly.
When I dream, there's alarm bells going on in my head.
I know of 3 registrars who had nervous breakdowns at Maritzburg, and I'm sure there's more, but 3 people who actually had proper nervous breakdowns because they just couldn't cope.
I tell you, being just an intern who generally is not completely held responsible for patients' care because you still are being trained. When I did my pediatrics rotation, and every time that we needed a ventilator for a child, we needed an ICU bed, and it wasn't available, and we had to play God and make a decision that this child who can live and can survive is left to die because there are just no ventilators. Every time that happened and I went back home, I would break down. I would sit, I would not be able to sleep, I would think about it. I would say, what could I have done differently?
Sometimes you get a phone call, you're not on call, and suddenly someone's sick. You just feel, you don't have to cover, but you just feel so obliged towards that patient. I've gone out to King Edward Hospital when I was a registrar, when I wasn't on call, because some registrar phoned me to find out about a patient. And if I couldn't get hold of that person, I actually drove out there to see what was going on too, because it's my patient. Fair enough, I'm not on call, it was a Saturday afternoon, but I've gone to see what was wrong with that patient, because that was someone's kid.
When I was an intern, I had a needle stick injury doing a favor for another registrar. Hematology reg, they don't have interns, so she asked me to put up bloods on a patient. I got a needle stick injury. Very fortunately, I had a full pint of blood to test. And I had absolutely no support and no help from the nursing staff who were on duty that night. I was putting up blood on a psych patient, so they were just completely not bothered. They were like, oh, well, we're having tea, come back some other time. And I said, I need to get my ARVs now. So I just grabbed all my stuff, trooped down to casualty where I knew I had a friend, and I sat down there and I said, please take my bloods, I have to start taking ARVs, and I know I need to do all of these things. And in the thick of it, the one guy comes to me and says, do you need counseling? And I just looked at him and I burst into tears. And it was the single most traumatic night of my life, because the next morning was my graduation. And just imagine, it's the night before grad, I'm on call, and you get a needle stick. I now have to drive 700 k's to Pretoria, puking all the way.
Obviously, you guys know, acutely psychotic lady comes in, and you know how we are so short-staffed in casualty. Comes in and have to ask the relative to now hold down the patient. And relatives, when they hold patients, they're like, they feel that they're going to break them. And then, and she's obviously kicking around and blah, blah, blah. I have everything there. And I have to take a femoral because she's totally shut down peripherally. So you have to put your finger there, you have to actually feel for the femoral pulse. And I put it and she jumps up and bah, in it goes. So, okay, fine. I thought,
I suppose
okay.
it comes with experience that
Yeah.
I'm one of the people. I will not do anything unless there's a nurse standing next to me.
Yeah, never again.
And I tell all the
Security,
interns, but they don't
nurse.
listen because when you're an intern, you have so much of work to do
Yeah.
that you need to finish
Exactly,
it.
you need to get on with it. But you know what was interesting about my incident was that it happened, and I said, okay, no, you blah 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 blah. Chances are 0.3%, no problem. You know, started taking the ARVs, went through the whole process, and I was absolutely fine until I phoned my boyfriend, and I said to him, oh, you know, I got pricked by a needle. He said, what? You know, and suddenly I realized that this thing affects, and my family also freaked out. And suddenly I realized that, and people do stereoconvert, and I realized that this thing actually affects you, your family, your sexual partner, everybody around you. You know, everybody was absolutely distressed, wanting to know if this woman was HIV positive or HIV negative.
It's not only about HIV, okay? With HIV comes TB. TB is absolutely
And hepatitis.
amazing in KZN at the moment. Now, I have a friend very close to me who was diagnosed with XDR TB sometime early last year, and he's currently still on treatment. Now, last year in about August, I had sort of, came down with the flu. I had a cough, and my cough persisted. Now, my cough persisted for about a month, and at this point in time, productive cough, okay, and I was terrified. Okay, so I tested. I took my sputum. I sent it to the lab. I tested for TB. I go to the lab. The lab staff lady says, we tested your sputum, and there was something there that might have looked like TB. So, I completely broke down. I'm like, what do you mean? What do you mean it looked like TB? It's either TB or it's not TB. So she says, no, we can't say, but we recommend you should go on TB treatment. So now at this point in time, I'm completely distraught. I'm destroyed because I know MDR TB and XDR TB it is rife in KZN. It is everywhere. Fortunately for me, I have somebody who works at Albert Lutuli, one of the laboratories. So I had sent my sputum to her. I told her to do a microscopy, to culture it, to see if there's any TB in there. Fortunately for me, there was nothing. Okay, and I did not go on treatment. Now the point is that in the hospital that I work at, we admit patients who we suspect have MDR and XDR TB, and they are not isolated. They are put into a ward, into a general ward, sitting with other patients. So
Everyone
the doctors,
is exposed.
the nurses, the patients, and what is even worse is that there are N95 masks, okay? The N95 masks are supposed to be provided to doctors daily. You are supposed to wear this all the time. But constantly, it is out of stock. It is out of stock. You ask people, exactly. I bought my own box. I have my own supply.
I work in the airway. I need to have my own protection.
Precisely. I wear my own supply of N95 masks.
Yep.
Because you bang your head against the wall, you just cannot get it.
It's never in stock.
It's never
Or
in
the
stock.
ones that they have are those
That's not the government's problem. Your hospital management is terrible. It's the
Oh,
stores management
please.
that's terrible, and it's the hospital management
Our
that's
hospital
terrible.
management
and government
is
we have to hold them
non-existent.
responsible. But unfortunately, there are no
That's if they're
channels.
there.
There are no channels for that.
No,
and
they're not in their
that's also
offices.
I am at currently. Last weekend, I did a call. On the Friday afternoon, there were no non-sterile gloves.
Yeah.
So much for HIV protection, universal precautions, wada wada. No sterile gloves in a 6.5. The surgeon operating for the weekend and the anesthetist, size 6.5 gloves. No, none in stock. Sorry, please use a size larger or a size smaller. Size smaller gives you paresthesia and you can't use the hand after a while. Size larger gives you a needle stick and then you have huge problems. So the icing on the cake was actually on that Saturday morning when my boss rocked up at work and said, "Hi, we're running out of stock of spinal needles. Could you please use them judiciously?" Because a spinal needle is for us to give an anesthetic. It's essentially a spinal anesthetic which allows us to block a specific region of the body, and you can operate, allowing your patient to still be awake and breathe and be there to see their baby. But it's an absolutely essential tool. Without that, how am I going to anesthetize the patient without putting them under general anesthetic and compromising them even further? Because there are huge airway risks associated with pregnant women. And here we were, running out of stock of spinal needles. no gloves, no spinal leads. But I've worked at other hospitals. Addington, we ran out of filters, we ran out of endotracheal tubes. We didn't have tubes to tube our patients. We had no antibiotics. If it wasn't for the fact that the consultant said, we will shut this hospital down, there is no way that management would have brought us anything.
Yeah, no wait.
There's
Let me
absolutely
tell you about that. Today is Thursday. Today's Thursday, and they still do not have
2 weeks
small
later.
sterile gloves. Okay. Now, just to stress on that point, if you have a glove that is loose and you're holding a needle, your chances of a needle stick injury it multiplies, drastically.
It's a similar story because I am now in Nortel Hospital. I'm in theatre, okay? You have to have a sepsis control. When you scrub, you need hot water. There has been cold water for the past month. Every time I'm trying to put a spinal, I am scrubbing, it's cold water, and I refuse to put my hands in cold water anymore. There are no non-sterile gloves. The sterile gloves are size 8, and that's it. You put a patient in the bed, there's no LMAs, there's no tubes. You don't have ringers lactate. This is theatre. If you have a patient that crashes and you need to resuscitate, you only have 200 mils of normal saline that you need to run into a patient. This is the reason why I'm here now.
No, I know a registrar that developed TB spine.
Yes.
She was a com service doctor. She was a com service
She
doctor.
went to med school with me. And
She was like top of her class. Or something.
yes, she was fantastic. And she was pregnant when they discovered she had TB, and she refused to take the TB drugs because it would compromise her child. And when the baby was born, she was now full out with TB, and she ended up in ICU, and her husband he was in private practice, sold everything to keep her on a ventilator, and she ended up in a wheelchair. I've seen her around a gate where she's in a
And let
wheelchair.
me tell you what the government did.
It's terrible.
The government
They
turned
didn't
around
even
and
pay
said,
her.
because they tried to tell the government, look, you need to compensate me.
Yes.
My wife was one of the best students in her class.
Yes.
She's a com service doctor,
was
right?
brilliant.
And she wants to become a medical registrar. So he said, look, compensate us with help us, understand that. The government turned around and said, find the patient that gave you TB.
How are you going to know which single patient that was?
No, we had a huge debate in the branch council because one of the doctors was saying they don't understand why why interns, when they come in, are not having routine blood tests and chest x-rays as a baseline. Because how are you going to prove then that somebody got an occupational illness,
Actually, you should
And
have chest
and people are like,
x-ray
and people are like, what difference does it make? You can never prove. Blah, 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 blah. Do you know how many forms you have to fill out
Yes.
just to claim compensation if you get infected with TB?
Health does not apply in our profession, basically.
Are you kidding? I picked up a pneumonia when I work in the airway every single day. I picked up a bilateral pneumonia. I went downstairs to the occupational health clinic in my hospital that I work at. I got billed $400.
Yeah.
I am serious. I
My
got
colleague
billed.
got billed for doing bloods post and ARV needle
Yes, for
stick.
needle stick
Yeah.
injury.
$800.
It's
I paid
happened.
$800.
Exactly.
I was operating on a patient, right? I put my finger in to take out the genta beans, and the piece of bone stuck me on my finger. So I took it out. I still said, shit, there's nobody else to cover me. I finished the operation, changed my glove, went and washed it out, went down to Prince Masheni Occupational Therapy. They took the bloods from me, gave me the ARVs, and I get a bill for $800 the next 2
Yes,
days later.
exactly.
$800. And the best one is that the ARVs were making me sick. So when I was taking it, I was actually getting dizzy. Right? So I called in sick. I told them, look, I need 48 hours just to get my head together. They took off my overtime for that time.
I've been sick. I've been sick from last week. I had the flu. I still have a residual cough. I coughed all the way through that summer meeting, but I was at work every day for the entire week.
Because if you don't go to work, Nazima,
Who's going to do the work?
Who's going to do it?
there's nobody to do it. And that's the crux of
And
my
I've been
argument.
working for 10 years. I must have only taken a maximum of 7 days of leave in the last 10 years.
And even then, somebody's going to make you feel guilty about it.
You work hard to make sure you put 2 patients in one bed, okay? Because there are no beds available. Some patients are waiting in Edendale Hospital, waiting in the queue forever, for 2 days. We administering medication in the queue on the benches because there are no beds.
You're not administering any medication. Have you forgotten?
There is no medication. Oh, by the way, there is no medication. Oh, sorry. And also, pharmacy tells you it's out of stock.
When the Hippocratic Oath was designed by Hippocrates and his students who were starting the medical science and the medical fraternity. They were a totally autonomous structure. And obviously they needed to have some kind of moral guiding principle that was going to protect the people that they were serving. Now we find ourselves in a situation where there's masses of us and we work in a system. The entire system has to be subjected to the Hippocratic Oath. I cannot fulfill my Hippocratic Oath if the system does not allow me to do that, which is what is currently happening. It is actually unethical for me to work in the current situation that I work in.
You said, could this be the evolution of a new Hippocratic Oath? You know,
Well, the Hippocratic Oath evolves. It evolves all the time. The clause about about abortion, for example, that was scrapped as soon as the abortion laws were changed. So it's not like this, like, I don't know, cast in stone, sort of like ideal. It's a concept that is relevant. Well, it's a concept that has shown itself to actually be able to change with relevance to the current day.
We've made our point by striking, in letting the public know what's going on. Now it is up to each individual doctor to let the patients know what's going on. If you can't do something for the patient, you tell the patient, I can't do, and tell the family, I can't do your CT scan because there's no funds, because the radiologist says they don't have it, they can't do the CT scan today or this week. In fact, today I had to turn down a baby from Port Shepstone Hospital with gastroschisis. The baby's 24 hours old. And it's a ticking time bomb. The longer you wait, the worse the prognosis for that baby. And I didn't have a bed, and Port Shepstone Hospital refused to buy out a bed for that baby because it would be too expensive. That baby's ICU stay would be like 2 to 3 weeks because he needs an operation, he needs TPN. And they refused to buy out the bed because it would be too expensive. Now, who are they to judge? So, I should call that doctor back and say, tell the mother.
There's ethics again. That's why we turned around and said we're fighting for our patients. That's true. I fought for my patients. I stood out there for 10 days in that burning sun, screaming my guts out. And now when patients come and complain to me, I tell them, but I stood out there for you. And you saw me standing there. And I stood, and I didn't abandon you. And if you look at it,
for instance, the rollout of ARVs. I mean, we had to turn down patients, a couple of patients in the HIV clinic to say, you're in the list to get your ARVs, but we have a problem. We actually don't have the drugs. Okay, so the guy was admitted with cryptococcal meningitis and ultimately died. And he was already waiting on the waiting list. Went through exactly. Now I had to. You see, that's the thing, because the parents were angry towards the doctors, and they said the doctors put the patients on the waiting list. But what about the rollout? Because it comes from up there.
Such a good point about channels of communication with government, who are the ultimate custodians of the patients, not us. We're just the people who work the system.
I think
They're the ones that are ultimately responsible, and our patients don't.
Say
But
they're
what
going to have
came
a
out-
hotline, and if we have any problems, we're supposed to directly call.
Unfortunately, what came out in the strike was that
and say,
all
"Hi, we
blame
have a
was
problem."
put onto us.
Exactly.
For anything that happened, they kept on saying that doctors will be held responsible,
Yes.
and they refused to take any responsibility for any of
even the
this.
Health Professionals Council, a council that's supposed to be protecting us, decide to jump on the bandwagon.
And the patients.
They decide to jump on the bandwagon. A labor relations issue where a doctor doesn't want to go to work because he's upset with his working conditions now becomes an issue where they say they're going to strike us off. So that's balls.
Basically, the economics that you're fighting for.
Let me tell you what happened. I had gone to the hospital where I work at during the strike time just to go and see what is going on. And according to me, there were no patients in casualty. There were no patients in MOPD. On an ordinary day, there would be at least 200 to 400 people there. And I went for our meeting that we usually have in the evening, and we received a document from the Department of Health which stated things at Mahatma Gandhi Hospital are functional and operational. And to me, that was completely irresponsible on their part,
Just propaganda.
because they misled the public.
Yes, exactly.
They misled the public.
Well, they also didn't
And-
tell the public.
Also said that all hospitals are functional 1 week.
Made my job so
And
hard.
they said that they had recruited people from recruited doctors from the private sector, and of course they responded and said, "We haven't heard from government at all."
At all.
It's only ethical that we put the work on hold and we get everything serviced the way that it should. We get all the equipment to be available. We get our time work schedule considered so that we do our best to get the work going. But if things would change, if the government would consider doctors' remuneration and make them better, improve our working conditions, I'd stay. I'd actually specialize. But in my head, as I'm going through the internship, Next year is COM7, and after that,
If the government gives us what we want, okay, there would be a massive shift in healthcare in this country, not because you would get a massive influx of doctors from the private healthcare sector who would come in. But now what has happened is that they have destroyed our spirit. They have completely trampled upon us. They are calling us animals. They are saying that we don't know what we are talking about. And ultimately, what does this do to the doctor of today? This chases the doctor of today either into the private sector or overseas.
I always said, when I qualify, once I specialize, I'll stay at least for 10 years because I always believe in the concept of giving back. And the thing of being in an academic hospital, you get to teach and you get to pass the torch to a new generation.
And you're a good teacher.
And thanks. But the truth of the matter is, up until the last day of the strike, I would have still stayed. Given the horrific state that the current public sector healthcare system is in, I would have still stayed. But on the last day of the strike, I have to confess, my spirit was crushed. And that was the day I decided that as soon as I specialize and as soon as I'm done, I have a family that I would like to have one day. I can't have that on my salary. I still have student loans and home loan to pay off. I would actually like to have my life back. And if that means going to private or going overseas, it's an option I will consider because I don't feel appreciated. Honestly, I've never once had any senior member of staff or any member of government or parliament phone us and say, "Hi, thanks so much for sitting with that patient for 36 straight hours. We really appreciate it." No one's ever said, "Thank you, well done."
I love what you said about I want my life back, but you should have also said I also want to be a doctor, and I cannot be a doctor in the system.
my dream is to basically help all those little kids out there that cannot afford good health care that any other child is entitled to.
My dream's very simple. Basically the government looks at this OST process as the magic bullet that we look at it as well, and actually agrees to it. And then we actually have an influx of doctors, and that's the first battle that needs to be won, that we have an influx of doctors within our healthcare system.
My dream is for a productive, revamped, reformed healthcare system. My dream is for a healthcare system that all of us sitting at this table would be proud to work in and we'd feel committed to, and we'd love to do it every day.
My dream is that the people who are sitting out there at the top to sort of have a little bit of a conscience and to sort of come down to grassroots levels, see what is happening, and for them to start being proactive and make the changes in our country.
My dream is for this country to get past ignoring and disrespecting the basic rights of people, so that we can start building a progressive society. And my dream also is to be a world-class practitioner.
I suppose my dream is for hospital CEOs, hospital management, area district managers, the Department of Health, to take accountability for what's going on in our hospitals and to finally do something to improve healthcare. We as doctors can do so much of complaining, but we also need to direct our complaining to them, and they need to take steps to improve the system, because that's the only way all our dreams are going to become a reality.